everyone, and welcome back to another edition about Your Adrenal Fix, where we teach exhausted and burnt out adults the truth about adrenal fatigue so that they can get their health back quickly. And it's really exciting for me to interview a new friend of mine, Dr. Seth Gilson. Seth was born and raised in South Florida. He graduated with a degree in biology from the University of Florida, and then he completed his dental school at Nova Southwestern. He's been an avid sports and health enthusiast, and he's played soccer in both South Florida and New York at the collegiate and professional level. So he has a mission to not only help oral health, but overall health, nutrition, environment, when he's consulting, diagnosing, treating, and coaching his patients and clients. So that's what makes it so interesting to talk to you today, Seth. So thank you so much for being on the call.
Of course. Thank you, Joel.
Yeah. So in that bio, was there anything that happened, or just you already knew you wanted to get into dentistry? Kind of tell us how you ended up winding up in the dental field.
Well, it's nothing in particularly special, to be perfectly honest. After long story short, my focus was professional soccer, and after sustaining an injury with that, I shifted, and I was always into health and wellness. I was into nutrition and obviously fitness, because that's where my focus was in my life. But when that shifted, I was also good at math and science. So I'm like, okay, my mom has been an ICU nurse since before I was born. So I kind of had that medical background in the house my whole life growing up. So I transferred to UF. I took a course there called Introduction to Professional Medicine. And it kind of takes you through all the different professions in medicine and things like that, from chiropractics to cardiology, interventional radiology, and obviously dentistry. And it was something I never really thought about, but I was really intrigued by it. So I started getting involved in more research and shadowing different doctors at the hospitals and private practice. And it really came to me that one of the cornerstones of health that we just don't realize is our mouths. It's the most interactive, other than our skin, it's the most interactive kind of organ that we have with the outside world. And what's going on with our mouth impacts what's going on with our body. And one of the ways I refer to the mouth is it's a doorway and a window. And it's a doorway, meaning things 99.9% of the time are only going in through the mouth, but it's a window because you can also see the inside from outside. So a lot of times we can tell what's going on with the mouth, with the body, based off of what's going on in the mouth.
Got you. So you knew once you did that, it kind of broke up when you mentioned the different course that you took, but I guess with all the different disciplines, it was an immediate resonance of, this is what I want to do, and that I see that there's this whole oral biome. Like, what was it was that right from the get-go? Or is that sort of evolved over doing it?
Yeah, that wasn't right from the get-go. My initial spark of interest was like, oh, okay, I can use the knowledge and the things that interest me, but in my mind, like math and science and stuff like that. But there's also an artistic side to dentistry, and then it's more interactive with people, and it's very hands-on. And I was a goalkeeper in soccer. I was always using my hands. I like doing. I don't just like seeing or researching. I appreciate research and reading and things like that. But the activity of doing and being an active participant in treatments and ongoing situations with patients was really intriguing to me. And like I said, it allowed me to explore my creative side in a sense because of that artistic aspect to dentistry as well. That was the initial kind of pull towards it.
Okay, that's interesting, because I look back at my journey, and I know when I injured my back and I didn't want to go for surgery and someone helped me that was a chiropractor, that's what I wanted to do, right? Because it sort of had that unique experience. So it wasn't like you had a specific experience with the mentor doctor that you decided to do that. It was just more of the right feel at the right time. It combined your background with your hands and your skill set to be able to get. But I'm just curious, like, no one ever really feels like they want to be in someone's mouth all day, right? I mean, did that kind of resonate with you, or like, did you kind of think about that, or not really?
I I don't recall having any, I didn't really even think about that part at the beginning. And so, like I said, once I took that course and I was also exploring different options of that, like I said, my mom's an ICU nurse, so I had kind of access to go in and shadow and be part of research and things at the hospital. And I could see what the different aspects of medicine were like. And it appealed to me to be able to interact with people more. So like, it was a little bit like you said, it was the right thing at the right time, more so than something significant in my life happened. Now, later on, which I can talk about now if you want, that is something that I did have there was an impactful period of time in my life, when I was already practicing, that kind of shifted me into the space where I'm at now. So
gotcha. No, we'll get there in a second. So I'm just going to follow it up because I felt like there's an interview that you did with me, and this is not payback. I just felt like it was a great interview, and there were certain questions that I really had to think about. My question to you is going to be a bit just one of those just no filtered questions, if you will. So was there a certain aspect of it? Because I guess when I got into chiropractic, it was the same thing. Like I see a lot of similarities. I was a soccer player. My mom's a nurse. And so there's a lot of similarities there. And when I got my back injured, it's like, okay, this is what I want to do. I finally knew what it was. And it was going to be a professional job. I didn't know how much insurance would reimburse and how the public really thinks about us. And, there's a lot of things you don't see foresight with. But with dentistry, I don't think there's any confusion about it's a really good professional income to get into dentistry, let alone I like that I'm working with people and I'm doing. So I guess a two-part question, did that factor into getting into it for you? And what percentage would you say of dentists that get into dentistry are doing it mainly because it's a very good profession to get into financially? What would you say on that?
Well, I can honestly say when I was debating in college, when I transferred after soccer, I really didn't know what I wanted to do. And just having a good profession and making a good income, for whatever reason, wasn't at the top of my mind. And like I said, I just had specific interests and I knew what I would be good at. And that I was like, okay, what would I like to do for the rest of my life? And science and math has just always been something that intrigued me. So I knew it was going to be something in the medical field. Now, I've learned a lot since then, and I've broadened my horizon since then. And I know there's a lot more than math and science going on in the world. But I just knew it was going to be something in medicine. And like I said, it was just the right moment at the right time. Like dentistry had never even occurred to me, other than going to the dentist for cleanings and stuff like that. Never even crossed my mind. Nobody in my family's a dentist. I actually don't even think I really knew that the actual income that a dentist would make at that point.
Right.
Now, as far as it's really hard for me to speak for other people. I can say from my experience when I was in dental school, I would say the minority of people were concerned with how much they were going to make once we finished school. To put an actual percentage on it, it's really hard. I really don't know. Now that I've been practicing for over 12 years, I think the perspective definitely changes. And I don't necessarily believe that that's a reflection on the individuals. Yes, we all need to make a living. And yes, we live in the United States, which is a capitalistic economy. I mean, to have a comfortable life, you have to make a good living. And financially speaking, obviously, there are a lot of other aspects to living a good life, which we may touch on. But to stay focused on your question, I think the way the medical industry itself is just set up with corporations and big pharma and these types of I don't know, these almost seeming like black holes that we've kind of created for ourselves. You get into these cycles where things are so insurance driven, like you had mentioned, that volume becomes a necessity just to stay in business in a lot of situations. Now, there are a few models in which it's taken me over 12 years to come to a bit of an understanding and reach a point where we don't have an insurance-driven practice. And there are some practices that are just completely dismissive of insurance. Like we don't deal anything with it. Now, we're not in network with insurance where I practice, but if depending on the type of insurances that patients have, we will accept their insurance, and then their insurance reimburses the patient. So whatever insurance you have, whatever deal you've made with the insurance, they're going to give that money back to you. We have nothing to do with it. We'll just send it and bill it for you as a courtesy, because that can be a hassle for people that don't do these things.
Right. I appreciate you answering the question and being a good sport about it. It's more of my thought, and it's very similar in the chiropractic profession too, right? You could be insurance and out of insurance and so forth. I was just curious that are people that are getting into the profession, are they doing because they just have this passion for the oral microbiome and the teeth and structural fixing it? Is there a little bit of both? They just kind of weren't really sure, and it sounded like a good idea. I was just kind of curious in a lot of different ways. Yeah. So okay, go ahead. Yeah.
No, I was just going to say that, I mean, it's really hard for me to say now. The few people that are trying to get into dental school that I know personally really are passionate about health and dentistry in particular. Those are generally foreign trained dentists that have moved here that want to continue practicing. But I would say the majority of people actually do care and enjoy what they're doing. And again, it's just the cycle that we find ourselves in this medical system that kind of breaks people down, and like that medical burnout that a lot of people experience. It's because we're not really taught how to handle ourselves, let alone present ourselves in a healthy way and practice 5 to 6 days a week and see X amount of patients a day and really do our best and be mindful about it. We're just not trained or educated in that aspect.
Right. Good. Thank you. So as far as switching it up, so you're a holistic dentist / biological dentist. So maybe give us the genesis of that. Was that something that you wanted to get into from the get-go, or you kind of evolved into that? And maybe for the listener that doesn't know what exactly that means, or what's that different between a regular dentist that's not holistic or biological, let's maybe talk about those two things. Okay.
So it was definitely 100% an evolutionary process. I would say at least 95% of dentists, if you go and you speak to them, it's probably gotten better, but in the 95% of dentists have never even heard of biological dentistry. Obviously, people have heard of holistic medicine. So that's why that term holistic is used. It's just so people, just hearing that term, they know what you're talking about or at least have an idea. Now, a lot of times there's a negative stigma attached to that, which is what we'll talk about now. So what biological dentistry is, it's completely science-based. There's a lot of research that goes on all around the world surrounding biological dentistry. And what that essentially is, it's in a similar fashion to functional medicine. It's looking for the root cause of what's causing the problems in the body, or in this case, in the mouth, and how oral health is connected to systemic health, and how systemic health is connected to oral health, and how they interact with each other through different avenues like the oral microbiome, which is and the gut microbiome, which is a huge topic of research these days.
So with that being said, not 90% or plus not knowing, it's the concept that just seems logical with what you explained to me is not being taught in the traditional approaches, or in the majority, like the 90% of the curriculums. They don't have very much training on that, and it's just sort of reductionistic. Let's just structurally address the mouth, and that's it. That's all.
A lot of it is very reductionistic, and they do recognize correlations with certain diseases to oral health, like diabetes and cardiovascular disease, because they're just pro-inflammatory or hyper-inflammatory disorders. But one of the big things that do in biological dentistry is focus on methodology and materials. And what we use and what we put, or essentially like fillings are basically an implantation into your tooth, or a dental implant, so to speak. What we put in your body needs to be what's called biomimetic or biocompatible, meaning your body needs to accept whatever it is that we're putting in, and the least amount of toxic materials that we can use, the better. And those are the types of things that we look at. I mean, even we go as far as providing patients with blood tests so they can actually go get blood drawn and see if they are reactive to any of the materials used in dentistry, whether it's a filling material, whether it's a polish that they use in the hygiene room, whether it's an oral rinse that's used, two different toothpaste, or pretty much anything you can imagine.
It's fascinating, Seth. So do you find that, because you stress the fact that the biological dentist is scientific based, which to me seems redundant. I would assume it would be, right? But I would imagine the reason you're saying that is because maybe some of the opposition from those that are sort of the rigid, reductionistic, traditionally trained, don't feel that there's a validation to it, or they justify that it's not science, or what was the need to sort of explain that? Yeah.
Because, I mean, for example, with like fluoride and mercury amalgam fillings, the research that's been done around these things, who's done the research? Where's the research originated from? And a lot of times we don't know these things, and the way the research is done, I mean, there's incentive to do things in a very particular way, whereas biological medicine or holistic medicine, there's no incentive. We're not looking for a particular outcome. We're testing and observing results, creating hypotheses, testing, and seeing if the results are the same again. And what we see time and time and time again is that these things are neurotoxic, for example, like fluoride and mercury in the body. And when you have bigger governing bodies, for a bit, especially in this particular case, the dental administrative bodies just don't seem to recognize that these things are a problem. And you have to, I mean, once you start looking deeper into where the research originates from, or where the funding from this comes from to this university, which did the research, which got published in this article. I mean, so yes, modern dentistry that we would see in a dental school is research based, but it's who's doing the research is right. The real big question.
Right. And you're tipping over sacred cows, right? I mean, these are things that have been long withstanded and I guess clinically proven with biased or unbiased information. And it's like that with every research, by the way, not just that, but there are some, it's interesting. I can't remember what the book was, but the story I read on how fluoride actually got approved was, and I don't want to butcher the entire story, but from what I remember, it was sort of a waste product of heavy industrial production, and being able to not pollute the waters or be able to monetize it and biasly create results that would show there's a need for it. It's just quite amazing. So is there sort of just, and it's not really the angle I wanted to take, but is there certain doctors, like I know when some doctors call themselves functional medicine doctors, but they're not functional medicine doctors. They do things very traditionally. They don't look at functional ranges. They're prescribing medications, and they're certainly not functional. So do you have that same phenomena of doctors that want to sort of capture the market that they would otherwise not be able to get by saying that they are holistic or biological as well?
Well, so two things to rewind a little bit with the fluoride. Another really interesting fact about that is that, I mean, we're in the age of double-blind placebo-controlled studies and all these things. There was no intensive research done on fluoride before it was actually implemented in the water supply. And if you look at, I mean, I've posted about these things on Instagram, and you can see the actual charts of different countries around the world and how they've reduced the amount of fluoride in the water as time's gone on. And it's Well, why? Because now that they've actually started doing research, they see that there are actually problems with it, and it bioaccumulates in the body, and that fluoride is just everywhere. It's in the soil, so that's in our food. It's in water. It's in 95% of dental products, not just toothpaste, but everything you get actually at the office. Like even a lot of times when the hygienist cleans your teeth and they polish your teeth afterwards, a lot of times that has fluoride in it. And it, like I said before, it's a neurotoxin. So now, going back to what you were saying, I have heard from other patients that have come to see me that there are other practitioners that say they are biological dentists or functional dentists, and they're not doing things the way we do them, which is, for example, using what's called the SMART technique. That's the safe mercury amalgam removal technique that was created by the IAOMT, which is the International Academy of Oral Medicine and Toxicology. So they've come up with basically like a baseline standard of how biological dentistry should be practiced. And then there's layers to that, of course. And again, that's the organization that is completely research-based. That's one of the organizations. So if anybody's curious, you can just go to IAOMT.org and you can find, and it's all on there for free. You don't have to pay for it. You can see all this about amalgam fillings. You can see things about fluoride. You can see things about root canals, different toxicity things that are used in general practice. So yes, there are people practicing that say they're biological or functional and aren't doing things to standard, a biological standard, based off of what I've heard from patients.
Gotcha. So as far as the IAMOT goes, is that if I'm a doctor like yourself, and I am of the mindset to be biological, and I join that organization, is it a matter of a membership fee, or do I take certifications to hold my status? Like what's entailed of being a member of that association?
So they actually just because this is I haven't heard anybody from that organization say this directly to me, but to me, biological dentistry is just dentistry. That's just how dentistry should be practiced. So they actually,
I agree. Yeah.
All of the information in the videos, the educational videos for dentists on how to do things is free. You can just go on their website and see how it's done. Now, to get a certificate from them, just like other professional organizations, because that's the only way they make money is through donations and through the dentists that join and pay their membership fees annually.
Right.
So yes, you pay a membership annually, and I mean, we have meetings 2 or 3 times a year. There's different groups and things that you can be a part of. There's mentorship opportunities within the organization. There's also you can become a fellow of the organization and kind of work your way up. And like I said, there's different layers to how proficient you want to become and well known as a biological dentist.
Yeah, you're not an imposter just like hanging out at the IAMOT if you're not of that mindset and you have that sort of that I guess the philosophy of approaching holistic healthcare that way. So I guess just to get off the subject with one more just inquiry, Seth, would you say that as the profession ages and turns over and have newer, younger, maybe more, I would think more open-minded, or at least not as dogmatic about the research and the studies and where it came from, that there's a turning over, like they say, like, I don't remember the exact saying, but as theories change as people die, right? Because you don't have the staunch dogmatic people defending something that's not accurate. They die, and now you have the truth prevails, right? So are you seeing a turnover in the profession in that case, or not really?
I would say it's slow, and that's because the big corporations, especially like the big dental corporations that are now taking over, right, instead of private practices, you have a lot of these bigger organizations that are creating like 10 offices in South Florida of whatever name of the office is. And a lot of times they offer, because these are big corporations, they can offer recent graduates great deals coming out of school. I mean, that's one thing that a lot of people don't understand, is like you were talking about before, that yes, you can make a very good living as pretty much any kind of doctor, but as a dentist. but you come out of school with a lot of loans too. So when someone's willing to pay you and a salary and you get these bonuses and things like that, it's very intriguing to someone that just recently graduated and has hundreds of thousands of dollars in loans to step into that kind of realm of things. And then that's just basically another corporate
Right.
hamster wheel, so to speak.
Right. They're not doing safe mercury amalgam removals. They're not like doing the sort of the different approaches in terms of the methodology and the materials being used and the fluorides and the awareness of all of that, correct?
They're not.
They're not. Yeah, I mean, I could see the intrigue, you know, especially same thing for me when I graduated and moved to Florida and I had to wait to take my license. The only places that would hire you are the big PI mills, right? And they're not really what I wanted to go to school for. And I lasted 2 weeks. I'm like, okay, this is it. I'm not going to stay here anymore. So it's unfortunate that happens. But anyway, so switching things up here. So I guess a sort of a left field question. What do you hate the most about your profession?
Well, that's actually really easy to answer. The insurance issues, the insurance companies, and how insurance. And now in the practice I'm in now, I don't have that. But we have it a little bit because, like I said, we still will submit things for patients, but the downgrading or the refusal to cover something for a patient when the patient was told or it's in their plan that this will be covered or they cover it differently. There's endless excuses as to or reasons as to why an insurance company will deny claims.
Right.
I'm sure this happens with your field.
When I remember in a past life, yeah. If you didn't rub your stomach and tap your head and jump on your foot and have a half moon out and the wind's blowing north to west, you're not going to get approved of certain, you know, procedures. Right.
And it's just everything's insurance driven rather than health driven for the unique individual. And that's one of the big reasons that I've shifted to where I'm at, because everybody's unique. All of our health needs are unique. Everybody's mouth. Yeah. Like you were talking about before, how you stare at you look into different people's mouths every day. How is that intriguing? But everybody's so unique and different. And we need to be treated that way in all of medicine.
Yeah, for sure. So as far as that's a good segue then in terms of you have your own social media and you're out there and you have something called Art of Mindful Medicine. So I'm curious to know of the genesis of that. But in your intro, you talk about you do all these interviews and this research or just going in these different areas because of you can't specialize in everything and you would want to be able to get as much information as you can. So two-part question, what does it mean, the art of mindful medicine? And what else would you be specializing in, or what areas are you wanting to go into with that being the case?
Well, so the art of mindful medicine, I mean, where do I start? Okay, so I'm also a yoga practitioner and a yoga teacher, and mindfulness has become a huge part of my life the past 6 or so years. And when the pandemic actually started, I'd been looking to how can I do something? Because before let's see, in 2018, I was getting burnt out. I was tired of just sort of treating the same thing over and over again and not being able to help people. So healing rather than treating. And it got to the point where I was burnt out and couldn't stand how practices were run and how everything was so insurance driven. And I just wasn't happy with how things were going. So I took about a 7-month hiatus. And I almost left medicine completely. And then I sort of decided through my own self-discovery and self-reflection that I would be of a better, more benefit and greater change, if of any change, from within medicine rather than from the outside. So through that, I started practicing and viewing the world differently. And that's when I started looking into and found biological dentistry. I had to seek it out myself. Nobody told me about it. I was just doing my own research on these things. And then the art of mindful medicine came about at the beginning of the pandemic, like I said before, because at that point, we couldn't even work. We weren't allowed to see patients unless it was an emergency basis. So I said, this is the opportunity for me to continue to go within and see what can I do to give back beyond what I do in my practice. So I came up with the name, The Art of Mindful Medicine, and I wanted to interview other practitioners that viewed the world in a similar way that you and I view the world, through a healthcare system rather than a sick care system. And through holistic medicine and natural medicine and functional medicine, finding the root cause of what's going on with the unique individual. And I wanted to learn from people like yourself and share from the things that I've learned and have conversations so we can share this with people that don't have the opportunity to look up what Chinese medicine is, what biological dentistry is, what functional medicine is. So you can come and see on a channel, you can learn from vegan cardiologists to different biological dentists to functional medicine doctors like yourself about how lifestyle impacts everything that we do in life. And it's not just your genetics, or it's not just luck of the draw that you're going to, whether you're going to be healthy or sick. So that mindful approach, that awareness of myself and the opportunity that I have to share what I've learned with other people, and in this present moment, that's where the art of mindful medicine kind of stemmed from. Because like I said, I've done research and I've done rounds, and I've shadowed in hospitals and different doctors' offices. I see how medicine operates, and mindfulness, the number one place mindfulness should be practiced is in medicine. And in what I've seen and what other people have shared with me, it is the opposite of that, where mindfulness is absolutely lacking in medicine, in the Western world anyways. So that's
Right.
kind of where that whole channel on YouTube stemmed from.
That's great. Thank you for sharing. So as far as where does that fit in now with your practice in terms of how you approach your patients and how it's being received, and what additional role you play? Where are you now and where are you headed?
So it allows me to, again, have a greater scope, a better view of the person as a whole, rather than just above their neck. Now, it's not that I treat other things, but I can tell people how I've chosen to live life, and I can tell people how these things have had impacts on my life and what I've learned through other practitioners like yourself, and refer patients to other practitioners like yourself when they have these kind of problems. And then we work together and we create like a health team, so to speak, because we have to address, when people are sick, you have to start from the ground up. And we have to cover all of our bases. And how that's worked for me, so it's allowed me to learn a lot about different areas of medicine and health that I just have, there's only so many hours in a day. And being able to share that with patients, say, hey, I spoke to this person, we did an interview, you can watch this video, you can go watch their videos here, you can find all this information, go explore, educate yourself to some degree, and learn about where these problems in yourself are coming from. And then we can have higher level discussions and start implementing new things in your life to be healthy. And where that's leading me, I don't have, I just know it's a direction. It's not necessarily a destination. And it's one which I'm constantly seeking to become the greatest version of myself, and learning as much as I can, and constantly being a student, and not just learning from other practitioners like you, but learning from people, learning from the patients, because people, that's one of the biggest things that I've learned to do, is to just listen. And that's one of the biggest differences in the way I practice now from the way I practiced before, is patience and spending time with people. And sometimes it can get a little carried away. I might spend a little too much time talking to people, but creating those kinds of relationships and creating a level of trust and respect for each other makes a huge difference. I mean, when when I authentically want to help you and you feel that, it makes a difference in how you want to approach the whole situation yourself. And that's what the art of mindful medicine is. That's what I've tried to create for myself, and that's one of my outlets in sharing it. So it's a direction, and I just want to grow that aspect of my life and my practice and share it with as many people as I can.
For sure. No, thank you for sharing. I think it's having the most impact, right, on the people that sit in your chair beyond just opening their mouth. And it's a win-win. The more that you can listen to them and hear them as a person and what their challenges are, who they are, it enriches you as well. So it's an equal exchange of energy. As far as I would imagine too, with having a biological practice base, these people are going to be more open to this versus if you were in the insurance-based model, that they might necessarily not want to hear it, and you're really going to be going upstream. So just a quick pivot, as far as what you love most about what you do, because we said hate, what about love now?
What I love most. The first thing that comes to mind is to getting to know people. I think we're such amazing beings, and we learn and can share so much with each other. And I constantly have the opportunity to communicate and meet new people on a daily basis. And like I said, that I'm a constant student, as I said, and I love the opportunity to learn from others every single day.
Do you find at all that the external rewards, whether it's a different smile, a more, I guess, even physical changes because of whatever toxic elements or chemicals, better health from that standpoint, maybe even less pain because they're not in a crisis like that? Do you ever see the product of your work immediately, and does that, how does that, like, what are some of the rewards you get from that?
Absolutely. I mean, for example, one of the most common bad habits that people have, that's probably one of the most underdiagnosed issues in dentistry, is what's called sleep disordered breathing, which is on the same spectrum as sleep apnea. And one of the symptoms of that is grinding our teeth. And this has been something that I've dealt with too. So it's very, very close to home for me to be able to talk to people about it. And people that actually really grind and clench their teeth for whatever reason that it's going on, they suffer severely. I mean, from jaw pain, neck pain, back pain. You probably have seen a lot of patients with this. Headaches, migraines, just they don't get good sleep, which is instrumental for our health, is sleep. So being able to work with people and get them to breathe better and create devices or prostheses which help them prevent them from grinding their teeth, and the almost instant relief of pain in some cases is amazing. I mean, the color comes back in their face.
Yeah, that's great. So that's a good segue into just the role, not so much yet into the oral microbiome, because I do want to get into that, but more in terms of minerals and food quality and the arches and the density of the bones and cavities and so forth. I guess, have you been doing it for 12 years? Did you mention that, or
a little over 12? Yeah.
A little over 12 years. Have you seen, or are you seeing now a change or more of an epidemic of bone density, just the arches, and a lot of consequences of societal changes environmentally accelerated in the last 12 years? Is that a big part of why we're seeing some of these challenges more and more?
I think it's a combination of things. So as my awareness has broadened and become greater, I've started to look and notice things more. Now, and you look at studies and if we read And we can see the tendencies over the last 50 years and how airway collapse and jaws not fully forming and or people narrowing of the faces and things like that is absolutely been a tendency. Like and nobody can deny it. It's just the question, the debate is around why. And yes, nutrition is a huge part of things. So mineral density and what our body is made of what we eat. And if we don't eat high quality nutrient dense foods, we don't get high quality nutrient dense results. So yes, jaw formation and arch width and proper dentition spacing and things like that, it absolutely is impacted by nutrition. And when I say nutrition, it's what we eat, but also how we eat. Chewing our food is we are chronic under chewers in the United States. And what I have to coach people to do kind of is to have at least 30 chews per bite of food. And one of the problems is processed foods. You don't have to chew it because it's already processed for you. It's pre-digested food essentially. So all these heavy starch foods and things like that aren't whole plant-based foods, you don't have to chew very much. So you can put in your mouth, bite 3, 4, 5 times and swallow it down and no problem. We need to be eating real foods because not only is that a natural cleansing process for our teeth, but it actually stimulates the jaw structure and the jawbone to form properly. So getting kids to do this from a very early age is essential.
Yeah, that's a great answer. So as far as some of the challenges or some of the things that you remediate, that you look at, that are some of the topics you've talked about on your channel, and you'll share that with our listeners, and we'll put it in our show notes before we're done, is the 3 topics, I guess we would talk, well, 2, I don't know if you probably talked about the 3rd one. I didn't have a chance to do as much intel as I wanted, but talking about root canals, right? So we'll go there. We're talking about mercury amalgams, and then I want to get into a little bit of cavitations and so forth. So maybe can you tell us about root canals in terms of take them out, leave them? I know you mentioned that that's 100% decision based on the patient and the doctor, but as the doctor, Seth, what do you like? What do we need to consider, and why is it harmful? And just give us the ABCs 1, 2, 3s on that.
So why it's potentially harmful is because the anatomy of teeth are very complex, especially when you get into the root structure. So a root canal, which people may or may not know, is that you basically take out the main nerve of the tooth. And then what you have to fill that with a biocompatible material to leave what's essentially a dead tooth in the jaw. Now, the problem is there's a lot of, like I said, the anatomy is very complex. So there's a lot of different canals in the teeth that we can't properly clean and instrument with the technology that we have. Now they're using different sonic technologies and lasers and things like that to try and be able to sterilize teeth completely. But at this point, we're not able to guarantee sterilized teeth 100%. And then so some form of tissue or bacteria is left behind in the tooth to fester. And there's no more blood supply to the tooth because that's been cut off when the root canal is done. So the immune system can't go and fight that area of the body. So that infection festers with anaerobic bacteria generally, and they create endotoxins. And a lot of times that creates a dental abscess or an infection in the jaw. And how that is going to affect me versus you versus somebody else is very unique to the individual. Some people don't even know it. Some people are also much more in tune with their health. And we have different toxic burdens, so to speak. So I might have my jar of toxic burden might be a gallon, whereas yours might be a quart. So you wouldn't be able to handle as much issues and inflammation going on in the body as mine might be able to. So how that's going to result in these types of infections have been linked to certain types of cancers, to Alzheimer's disease, to thyroid disorders. There's just a plethora of different things that have been linked to root canals and what can happen from these types of infections that are left when not done properly. Now, is that every single root canal? No. How do we check for these things? Ideally now, in my view, the standard of care should be using a CT scan, 3D imaging, to be able to see what's going on in the person's jaw. And generally, if there's no signs, no symptoms, nothing going on, most of the time I'd say we can leave it alone in those types of circumstances, because we have to live in the real world too. Not everybody can just, come in and start. Some people have 4 or 5 root canals. Some people can't either don't want for whatever reason, or can't afford to just have all these teeth taken out just because they have a root canal.
It would be an implant. I'm sorry to interrupt. So if you have a root canal that you're revising, you're just replacing the entire, there's so many questions I have. So what are you doing to revise the root canal?
So if there's an infection with the root canal, what you do essentially at that point is you can choose to have the root canal redone, which I would just never recommend, because the success rate is substantially lower than what just doing it in the original for the first time. And the alternative is taking the tooth out, cleaning out the entire infection. We use ozone at the office as an antimicrobial as well. And then generally bone grafting the area. We use something called PRP, which is the patient's own blood that we spin in a centrifuge, and it basically concentrates the patient's healing cells in the body into a little membrane, and we put that over the extraction site and you let that heal. Then later on, you can choose to leave it, which I don't generally recommend. You can also have a dental implant placed, or you can have something removable placed. But the ideal situation is to have a dental implant, because that's the closest thing you can get to a natural tooth.
Gotcha. Thank you. So just to back up, why would someone need the root canal in the first place? What went wrong?
So the nerve became damaged irreversibly in some way or another, whether it's through a cavity, through trauma, a fracture, something like that.
So it's typically a cavity, right? Is that the majority of the reason someone's going to need a root canal?
I would say yes, because a lot of times the tooth fractures because there was a cavity that wasn't treated.
Right. And that could be secondary, not just to eating sugary foods, but because of minerals and density and fluorides. And so as far as when you said cleaning the instruments, you're actually saying the things that you go in there to do the root canal, is that what you're saying? That you're not able to disinfect the instrument that you're using, or you're not, when you say instrument, you're not able to, when you remove the root,
when I mean instrument, I mean, we use the instruments, but I was talking about instrumenting in the tooth. So we're not able to completely sterilize the internal environment of these root canals 100%.
Right. Are there, now you also mentioned biocompatible, biocompatible materials. Yeah. I mean, what's the difference between just a regular, not biological dentist and a traditional dentist with the materials that they're using?
Mm-hmm. So a lot of just for example, fluoride and mercury amalgams. I mean, some people still place metal fillings and mercury amalgam fillings in people's teeth, which is astonishing to me, but they still do it. And mercury is a neurotoxin. Fluoride is a neurotoxin, and fluoride is in definitely most of the composite resin filling materials. And it's something that gets released over time. So the material is placed, it's cured, it's hardened, it's in the tooth. And over time, they've figured out ways to have fluoride slowly leaching from that material to help stabilize the tooth, from what they say. Now, again, fluoride is a neurotoxin. If you ask these reps in these companies, do you know how much fluoride is released from these and for how long? They have no idea. And the ones that do require you to sign a non-disclosure agreement to actually tell you the information.
Interesting. So, okay. So as far as, when you do, is it that 3D cone beam x-rays that you're talking about is the gold standard? And then are you seeing sort of silhouettes, pockets of dark spots that would suggest infections? How are you determining the gold standard of, yep, it's infected, we need to do something about it, or no, it's not, or your toxic load is not that bad as mine? What else goes into deciding that? Like when you do the x-ray,
So
how do you determine? Yeah.
what we do is we always have a radiologist, a trained radiologist read these reports or create
Okay.
reports. So
Right.
they create reports and when we review the pictures as well. And a lot of times you can see the infection, either an infection or a spacing between the tooth and the bone, meaning there's some sort of inflammation there. And sometimes there's not. And then again, it's just something you watch. And if there's no signs of anything going on, then it's something that we just monitor every 3 to 5 years. Because look, we're three-dimensional objects. If we just take a regular X-ray, that's a two-dimensional picture of what's going on. These CT scans, we can see things in 3D, and you can create slices where you can see exactly what's going on in different layers, both width and height of the tooth. So you can see not only if there's an infection, but where it is and how big and where it's extended to, if it's affecting the sinus, if it's close to a nerve, things like that. And that's where I was also talking about before, where we create a health team. So yeah, some people might have an abscess. They could have had an abscess there for years and not known it. But how is that affecting their overall health? That's what we were talking about before with the toxic burden. That's where the health team comes into play, where we would have someone see like a functional medicine doctor like yourself, and then you run blood work and you can see what else is going on in the body, what else is causing inflammation. Are there any other diseases or disorders or imbalances that the patient most people a lot of times aren't even aware that they have imbalances going on.
Right. Yeah. Some of my toughest patients where we've done everything, like, okay, there's got to be something. I always, okay, we got to go look at your mouth now, right? Because that's a major problem. How often when we talk about cavitations, I would imagine that's very similar to, is a cavitation only defined as when you extract the wisdom teeth and there's pockets of fluid, or could that even be a cavitation where there's been a root canal and there's signs on a 3D x-ray that's the problem? Is that what the cavitation is?
Yeah, it's basically what happens is when any tooth, it doesn't have to be a wisdom tooth, but a tooth is removed and essentially dead tissue remains and builds up and becomes almost like a fluid and gel-filled pocket in the bone, and that the body kind of wards off and just kind of tries to keep in that area of the jaw. But yeah, it doesn't have to be from necessarily a wisdom tooth.
Can it be from a root canal or no?
A root canal tooth, yeah.
Root canal tooth can have a pocket of fluid that would be defined as a cavitation?
No. So a cavitation is like once a tooth is already missing, there's this radiopathic area in the jaw. So basically, it looks like there's an infection where there's no other tooth around it or anything like that.
I see. But it would be very similar in terms of physiology, that where the root canal was done, that there wasn't sterilization and there was a lot of festering buildup of anaerobic microbes, that it creates the same issues that a cavitation would. Are they looked at similarly or not really?
They're not really looked at similarly. It's different because a lot of times when you leave necrotic tissue in the jawbone, if it's not, that's why when we remove teeth or do any kind of surgeries, the entire area needs to be properly cleaned, not just the soft tissue, but also the bone around it that was warding off that infection is generally dead too. So when you leave that behind, that's where these kind of areas of cavitation can form, because there's no fresh and healthy blood supply to the area, so the immune cells can't help heal that part of the body. It's similar to root canals, but it's a little bit different.
Right. I know. I appreciate it. I get now after talking to you, and I appreciate it, where having dexterity and being good with your hands and having a good skill set would really matter as a dentist, right? Because you're doing these precision like maneuvers. I guess, I mean, just like any profession, there's great stars and there's not so great stars, right? I would imagine that happens all the time.
I would imagine so. I mean, obviously some people have better manual or hand-eye coordination and better dexterity than others. Right.
So as far as we won't go too long, but as far as mercury amalgams, would you recommend in every instance that someone has an amalgam that's mercury, that they shouldn't have it in there?
What I'll say is I would never have one in my mouth. based off of
Right.
what I know.
Yeah. Why is it sort of a taboo subject?
I don't know. I honestly don't know why, because there's nothing, it doesn't improve your health in any way. You know, the mercury is a known neurotoxin, and there's, like, again, like on the IAOMT, there's plenty of research showing how mercury vapor is released from these fillings when there's any sort of excess heat created. So when you're having hot coffee, if you're grinding and chewing your teeth commonly, I mean, you're creating friction, which creates heat, and that is going to release mercury vapor. How much, over how long? I mean, it varies per the individual, but breathing in these things is the worst way to become exposed to it.
Yeah, but why is it taboo though? You didn't really answer that. Like, I
So,
mean, yeah.
I mean, I guess it's taboo because it's been used for so long. Because these things, it's been used for decades, and the FDA the FDA just a year and a half ago just now came out in the middle of the pandemic, saying that certain people, certain individuals, pregnant women, people that want to get pregnant, people, women that are breastfeeding, people with kidney disease, people with other chronic illnesses, people with neurocognitive disorders should not have these types of fillings placed. Now, why is that? Why? So there's become some sort of recognition, and I think people in these organizations are inching closer to saying, all right, we're not going to use this anymore. Everything else is better. But I don't know if there's ever going to be like, oh, these things caused all these problems, this is why we're not going to use it anymore. But they're just inching away from using them.
Yeah, I get it. But 88, if not more, % of Americans are metabolically unhealthy. And I think you could extend it to 88% or more should not be having that exposure. And I agree with you too. I think it's a little bit of cognitive dissonance. If I was a dentist for 50 years and I was very dogmatic and didn't want to think about me kind of making problems worse, I could either change my belief or change my behavior, right?
Mm-hmm.
And I guess the belief is to somewhat justify it. And I think also too there'd be a lot of fallout in terms of admitting wrongdoing, right? With all the people that have had, it's unfortunate that it happens. And thank you for being forthright with your approach and being diplomatic about it too. So I appreciate that. So as far as oral microbiome goes, why is that important, and how can we maximize our oral microbiome, or at least not maximize, but make it as healthy as possible?
Yeah, so the oral microbiome and really the gut microbiome has become one of the biggest research topics in the world the past decade or so. And one of the reasons why is because we discovered that about 50% of the DNA in our body is bacterial. So that impacts our health, like the health and the balance of the bacteria in our body impacts our health directly and as well as indirectly. So the microbiome is basically all the microorganisms that make up a particular area of the body. So there's the oral microbiome, you have a nasal microbiome, your lungs have their own microbiome, your brain has a microbiome, and then the gut. But the gut's the mouth all the way through to the other end, and there's different makeups as you go down. And as far as how we can optimize it, everybody has a unique microbiome, like everybody has a unique fingerprint, but there is a lot of overlap. So again, there's still a lot of research going into this, how we can optimize things. Some of the best things we can do is oral hygiene practice. Great oral hygiene practice is so important, just because our diets are not optimal. Even if you're eating a majority plant-based foods, it's the nutrition density in a lot of our foods these days isn't what it once was. So proper nutrition, proper oral hygiene, proper going to the dentist.
And when you say proper oral hygiene, sorry to interrupt, what do you mean? Flossing, brushing?
Flossing every day, every night before you brush, and brushing twice a day.
No
people get
no fluoride toothpaste,
no
right?
fluoride
Can you,
toothpaste.
is there access to a lot of those? I mean, are there specific brands that you can get now that go out of your way that doesn't have them that you like, that you recommend?
Yes, so the one that I use myself is a brand called Risewell, and that's what we use in the office. And there's another brand that's also, I've heard, is also really good, called Boca. And these two brands, they're all natural ingredients, and the main active ingredient is something called hydroxyapatite. And hydroxyapatite is a natural compound found in our body that makes our teeth and bones hard. And this is actually, through research, is shown to remineralize and help with sensitivity better than fluoride. And it's safer because it's not toxic at all. It's a natural compound.
Right.
So all of these affect the oral microbiome.
Right. Got you. And do you recommend, there's kinds that have activated charcoal, or there's rinses with ozone, things like that? Do you ever recommend those as well, or not so much?
Mouthwash is actually one of the biggest problems when it comes to the oral microbiome. You want to never use alcohol-based mouthwash. Anything that says it's antimicrobial is just killing everything in your mouth, generally speaking.
Right.
So the over-the-counter mouthwashes and stuff, I would never really recommend. I know Risewell has a mouthwash that's all natural. I'm not sure about Boca, actually, but those things will all impact the oral microbiome. And
there's also a lot of ozonated stuff too. What's your thought process on that?
So if you're going to use something regarding ozone, you have to work with a practitioner that knows how to use ozone. Now, there are some things that I think you can get over the counter, like ozone gels and things like that, but it depends. It really just depends where you're getting them from, what source you're getting them from. So I would always suggest getting it from your biological dentist if you're going to use an ozone gel. And for example, we use ozone water and ozone gas in the office every single day. But you have to work with a trained practitioner that knows how to properly administer and use these things.
Right. Yeah, I have a podcast that I interviewed someone on that and gave me some insight. And I always like to talk to the professional to get their insight as well. So I could talk to you for more and more. There's so many things that I want to get into. Maybe we'll have a part 2 if you're open to that. But I appreciate your time, Seth. As far as the question that I always like to ask people on my show is, knowing what you know now versus what the bright-eyed and bushy-tailed Seth may not have known back then, what would you have told yourself that would have helped you with your health journey in terms of just being healthier, more proactive, dealing with life, stress, any type of health issues? What would you have told yourself now, then, that you know now?
I think one of the most instrumental things that I've come to understand is that phrase, know thyself. And I feel once we learn to go within and learn about ourselves, we can better understand and show up in the world around us. And that is what led the start of that journey is what kind of led me down this path to becoming and constantly wanting to become the best version of myself.
Yeah, no, that's a great answer. It's kind of along the lines of what I said, where, the cognitive dissonance, when you don't know yourself and you're acting out of alignment with what sort of resonates with you, that creates a lot of internal stress, right? So the more you're authentic and you're not hypocritical and you practice what you think, right, and there's not any incongruency between that, then have you felt like there's a shift in your health? You're not as burnt out anymore like you were at the start of COVID and stuff like that?
For sure. 100%. I mean, I come into the office every day feeling more energized, and I leave feeling more satisfied because of it.
That's great. So how do people find more out about what you do? You have your own YouTube channel. You practice in South Florida. Give us some insight on where to find you.
Yeah, so you can find me on Instagram. It's at mindful.doctor. The YouTube channel is The Art of Mindful Medicine. And I have a website called www.mindful.doctor. And then the office website is www.ourholisticdentist.com.
All right, I'll make sure I put those in the notes as well. And I will say on like out loud to keep myself accountable, I have some major dental issues that I have to go see Dr. Seth with, and I would love to be showcasing my journey. I still have mercury amalgams in my mouth, and for some reason I've been the doctor, not the patient. So it's time to switch that up and showcase my journey. So you'll have to keep me accountable now that I've broadcasted that to the millions of people that watch this. So super excited to talk to you, Seth. Thank you so much for all the information you provided. Any last words of wisdom that you want to share?
No, I just want to thank you. I'm really grateful for the opportunity to come and talk and just share my experiences and what I've learned and what I'm continuing to learn, and just to stay grateful for where we are, what we have, and the wonderful lives that we're living.
Yeah, absolutely. We after our last podcast, we talked about maybe being able to help each other, because your chocolate and my peanut butter, can work really well together in terms of looking at what else can someone do besides doing these safe removals and being able to really get their oral microbiome in check. There may have already been lots of challenges that are impacting their energy production, their ability to detox. Then they have these genetic susceptibilities that make these things worse. But from my point of view, the ones that aren't responding, what should be typically, okay, probably should have started with the mouth and what's going on, but usually it's one of those things that doesn't get addressed right away. And you'll see the combination of our work together really improve the lives of a lot of people. So thank you so much, Seth. And I look forward to our next conversation.
Yeah, me too. Thanks, Joel. I really appreciate it.